Okay, so are you ready for this?
Ready as I'll ever be.
All right, then let's dive in. Today we're going to be, we're going deep into the world of pharmaceuticals.
Oh, boy.
But with a twist, right?
Okay, I like twist.
We're dissecting a list of commonly prescribed drugs, all starting with the letter, wait for it, T.
Ooh, T. Interesting.
It's like...
very specific.
It's like peeking behind the pharmacy counter.
Okay.
But way more engaging than just watching someone count pills.
I can only imagine, yeah.
Right.
Yeah.
The thing is,
yeah,
this approach, this T approach, is kind of cool because it lets us explore not just the names of these drugs,
right,
but the surprising connections and like the underlying mechanisms that unite these drugs.
It's like the hidden web. Like like the connections that you don't think about. Right?
Exactly.
Yeah, fascinating.
So our guide on this journey, our Sherpa, if you will, is Dr. Khaled Hassan's podcast, which, I mean, wow.
Oh, yeah, he's amazing.
It's a treasure trove of pharmaceutical knowledge.
Yeah, I was listening to it the other day, and I was like, man, there's so much in here that I didn't even know.
I know, it's awesome.
It's great.
So are you ready to decode this alphabet soup of modern medicine?
Let's do it. Let's decode it. I'm ready. I've got my decoder ring.
All right.
Let's go.
So let's kick things off.
Okay.
With a name that I think everyone kind of recognizes, right?
Right. Cute.
Tadalafil.
Ooh, Tadalafil.
Better known as Cialis.
I was going to say that. Yeah, Cialis, the little blue pill.
Yes, the little blue pill.
That's become a household name.
That has become a household name for sure.
Everybody's heard of that one.
But here's the thing.
Yeah.
There's more to this drug than meets the eye.
There's more than just, what people think of at first glance, right?
Way more.
Yeah.
I mean, it all boils down to smooth muscle relaxation, right?
So essentially, yeah, that's the core of it. Tadalafil as a PDE5 inhibitor,
right?
It basically encourages those muscles to just chill out.
Right, like just relax.
Relax, like let go of the tension.
Yep.
And this relaxation is what's key for both its uses.
Okay.
Erectile dysfunction and benign prostatic hyperplasia, or BPH.
So the same. Hold on. So the same thing that helps with with that.
Yeah.
Also helps with an enlarged prostate.
It does.
That's fascinating.
It's pretty wild, huh?
Yeah.
And that's a great example too of what we were talking about earlier. Before you start taking anything, yeah.
Yeah, absolutely.
Make sure it's right for you.
All right, so let's shift gears here a little bit.
Okay.
To a drug that tackles a completely different issue, and that's sleep.
Sleep, everyone's favorite topic.
Everyone's favorite topic, I know, right?
Yeah, or lack thereof.
Yeah.
For some of us.
So we've got Temazepam.
Okay.
Or Restoril.
Restoril, yeah.
Which is a benzodiazepine that's prescribed for insomnia.
Insomnia. So benzodiazepines, right?
Yeah.
Think of them as like amplifying your brain's natural chill out signals.
Okay.
They basically enhance the effects of certain neurotransmitters, and that's what creates that calming effect that can help people who are struggling to fall asleep, stay asleep, or just have a really restless night.
So it's like putting your brain on like do not disturb mode.
Exactly. It's like silencing the notifications in your brain, right? So it can finally rest.
Yeah.
And it's interesting because, insomnia and the use of sleep aids, it's a hot topic these days.
It is, yeah.
I mean, everyone's talking about sleep, right? Like how important it is.
Yeah.
And there's also this growing concern about whether these medications are being overprescribed.
Yeah. That's a good point.
And it kind of makes you wonder, are there better ways to address these sleep problems that don't necessarily involve pharmaceuticals?
Yeah, like are there natural ways or therapies? Or,
yeah, exactly. Lifestyle changes, all of that stuff plays a role, and it's a really complex issue. Like there's no easy answer.
It's not a one size fits all.
Definitely not. Yeah. But it's definitely something worth exploring and
pondering, thinking about.
Yeah, absolutely.
Okay, well let's move on now.
Okay.
To a more serious topic, I think.
All right.
So we got Tenofovir.
Tenofovir, yeah.
Which is a component of the drug Atripla.
Mm-hmm.
And it plays a vital role in the fight against HIV.
That's right. That's a really important one. So Tenofovir, it's what we call an antiretroviral drug.
Okay.
And what that means is that it basically disrupts the HIV virus's ability to replicate itself, to make more copies.
So it's like,
think of it like throwing a wrench in the virus's machinery,
Gotcha, like gumming up the works.
Exactly.
I like that.
You don't want that virus to be able to make more copies of itself.
Right.
And Atripla specifically, it's really interesting because it combines multiple different antiretroviral drugs together.
Oh, wow.
So it's like a multi-pronged attack against the virus.
Like a 1-2 punch.
Exactly.
Really knock it out.
I got it.
Okay, so next up is a medication that, like Tadalafil, boasts a double duty role.
Ooh, I like these multitasking.
I know, right?
Okay.
So we've got Terazosin.
Terazosin.
Which you might know as Hytrin or Tezruly.
Okay. Yeah, so Terazosin, it's what we call an alpha-1 blocker.
Okay.
And basically what it does is it blocks specific receptors in your body, and that leads to the relaxation of blood vessels and also muscles in the prostate.
Okay.
So that makes it effective for treating both high blood pressure.
Wow.
And BPH, which we talked about earlier, benign prostatic hyperplasia.
So it's like finding out that your multi-tool can also julienne vegetables.
Exactly. It's like, wow, this thing can do more than I thought.
Yeah, it's got like a hidden feature.
Exactly.
And it's really remarkable how seemingly unrelated conditions can share a common treatment pathway.
That's the beauty of pharmacology, right?
Yeah,
that sometimes these pathways and these mechanisms overlap in ways that we don't always expect.
Totally.
But, when we figure those things out, it can really be beneficial for patients who are dealing with multiple issues.
Absolutely.
So it's a win-win.
Okay, speaking of multifaceted drugs.
All right, lay it on me.
Let's talk about Tetracycline.
Tetracycline, okay, a classic.
Yeah, and you might recognize it under brand names like Ala-Tet, Brodspec, or Sumycin.
Yeah, it's got a lot of different names, which can be confusing, right?
It's very confusing, I know.
For patients and even for healthcare providers sometimes, yeah.
Yeah. So what is Tetracycline, and why does it have so many different names? It's like every drug has a secret identity.
Right. It's like they're all superheroes with their alter egos.
Right.
So Tetracycline, it's a broad spectrum antibiotic.
Okay.
Which means it can tackle a wide range of bacteria. And it works by interfering with bacterial protein synthesis.
Gotcha.
Basically, it stops those bacteria from growing.
So it's like putting them in timeout.
Exactly. Timeout for the bacteria. You're not growing anymore.
Yeah.
And as for the multiple names.
Yeah, that's the real mystery.
It often comes down to patents and marketing within the pharmaceutical industry. Companies might patent a specific formulation or a slightly different way of making the drug, and then they give it a new brand name.
So it's all about branding.
It's a lot about branding, yeah.
Gotcha.
But at the core of it, it's still the same active ingredient.
Okay.
Just packaged and marketed differently.
Makes sense.
Yeah, so it's good to be aware of that,
Totally.
Don't get too caught up in the brand names. Focus on that active ingredient.
Speaking of breathing.
Ooh. Okay, we're shifting gears again.
I
like it.
Let's move on to Tiotropium.
Tiotropium, all right.
Better known as Spiriva.
Spiriva, yeah, I've heard of that one.
Yeah, this one's used to treat COPD.
COPD, chronic obstructive pulmonary disease.
Yes.
It's a big one.
It's a big one, and when I hear COPD, I immediately think smoker's cough.
Right.
But it's way more complex than that.
It is. It's a chronic lung disease that makes breathing incredibly difficult for people who have it.
And so Tiotropium, which is an anticholinergic drug, works by blocking a neurotransmitter called acetylcholine.
Acetylcholine, that's a mouthful.
It is.
But basically what that blockage does is it helps to relax and open up the airways.
Okay.
So for folks with COPD who are really struggling to get air in and out, this can make a huge difference.
So it's like clearing a traffic jam in the lungs.
You got it. Exactly.
Okay, I like that.
That's, you got all those cars backed up and then suddenly you open up another lane and things start moving again.
I love it.
That's kind of what tiotropium is doing in the lungs.
Okay, now on to...
All right, what's next?
Tizanidine, or Zanaflex.
Zanaflex, okay.
And this one's a muscle relaxant.
Muscle relaxant, yeah, those can be helpful.
Yeah, I mean, I think...
What's next?
Tizanidine, or Zanaflex.
Zanaflex, okay.
And this one's a muscle relaxant.
Muscle relaxant, yeah, those can be helpful.
Yeah, I mean, I think most of us have encountered a muscle relaxant at some point.
At some point, for sure, whether it's for an injury or just general muscle tension.
Exactly. But what are muscle spasms exactly?
Yeah, so muscle spasms, they're basically sudden involuntary contractions of muscle or a group of muscles. And they can be really, really painful. Like, think of a Charlie horse, right?
Oh, yeah.
Yeah, that's like a classic example.
The worst.
Yeah, so Tizanidine, what it does is it works in the central nervous system to reduce that muscle spasticity, to ease those contractions.
So it's like telling those overactive muscles to chill out, to relax.
Exactly. It's like saying, hey, muscles, take a break. You're working too hard.
I like it.
Let's ease up a little bit.
Okay, shifting to a more sensitive topic now.
Okay.
Tramadol, also known as Ultram, is an opioid used for pain management.
Right. So opioids, obviously a very important class of drugs, but also, you know, something that we have to be very careful with.
Absolutely. And you mentioned moderate to moderately severe pain.
Yeah.
When would a doctor prescribe Tramadol versus something else? Where does it fit in on that pain management ladder?
That's a really good question, and it's important for people to understand this, right? Because there's a whole spectrum of pain medications.
Right.
So Tramadol, it's considered a weaker opioid compared to something like morphine or oxycodone.
Okay.
So it's often prescribed for pain that's not responding to over-the-counter pain relievers like ibuprofen or acetaminophen.
Right.
But it's also not severe enough to warrant those stronger opioids.
Okay.
So it occupies this kind of middle ground in pain management.
Gotcha.
And, you know, given the current opioid crisis that we're facing,
absolutely,
it's really important to understand the nuances of these different medications.
Totally, Cole.
And to, you know, make sure that they're being used appropriately.
Yeah, and under the guidance of a healthcare professional.
Always.
Always.
Yeah.
Okay, so for something completely different,
all right, hit me.
Trastuzumab, or Herceptin.
Herceptin, okay.
Is a monoclonal antibody used in cancer treatment.
That's right. So we're moving into the world of cancer therapy now.
Yeah.
Which is a whole other ball game.
It's a whole other world.
Yeah. So monoclonal antibodies, think of them as like these smart bombs that target specific cancer cells.
Wow.
So instead of just, you know, attacking any cell in the body, they're very precise. They're very targeted.
Targeted therapy?
Exactly.
I've heard that.
So Trastuzumab specifically, it zeroes in on a protein called HER2, which is overexpressed in certain types of breast cancer and also some other types of cancer.
Okay.
And by attaching to that HER2 protein, it can help to slow or stop the growth of those cancer cells.
So it's not a cure-all,
right?
But it's a targeted tool for specific types of cancer.
Exactly, and that's the key with a lot of these newer cancer therapies, right?
Yeah.
Is moving away from that one-size-fits-all approach,
right? And
really trying to tailor treatments
to the individual.
And to the specific type of cancer they have.
Yeah, that's incredible.
It's pretty amazing what they're doing these days.
It really is.
In terms of research and development.
Okay, now back to mental health.
Right, back to the brain.
We have Trazodone. Marketed as Desyrel.
Yeah.
Treats both depression and insomnia.
That's right. So this is a kind of a unique one.
Yeah. How does that work?
Well, it's classified as an antidepressant, but it also has these sedative effects. So that explains why it can be used for both of those conditions. However, the way it actually works in treating depression, it's complex and not fully understood. It doesn't work in the same way as some of the more typical antidepressants, like SSRIs or SNRIs.
So it's a bit of a mystery drug.
In some ways, yeah, it's still kind of a puzzle that researchers are trying to figure out.
Interesting. Okay, well, on to our penultimate drug, Triamcinolone.
Okay.
Or Aristocort.
Aristocort, yeah.
And this is a corticosteroid.
Corticosteroids.
Which I hear all the time.
They're very commonly used.
Yeah, but don't fully grasp, like, what are they?
So basically, think of corticosteroids as these powerful anti-inflammatory agents. They work by suppressing the immune system and reducing inflammation throughout the body. And because inflammation is involved in so many different conditions, that's why corticosteroids are used for such a wide range of things, like from allergies to autoimmune disorders, skin conditions.
So they're really like the Swiss Army knife.
Exactly. They're very versatile.
Medications, a very fitting analogy,
Okay, so last but not least,
all right, bring on the finale.
We have Triamterene.
Okay.
Marketed as Dyrenium. It's a potassium-sparing diuretic.
Potassium-sparing, that sounds important.
It does, and it's quite specific.
It is. So diuretics in general, they help your body get rid of excess fluid.
But some diuretics They can also cause you to lose potassium,
Mm-hmm.
which is a really important mineral that your body needs.
Right.
So Triamterene, it's special because it prevents that potassium loss.
Okay, that's good.
And that's especially important for people with high blood pressure.
Right.
Because potassium actually plays a role in regulating blood pressure.
So it's like a diuretic with a safety net.
Exactly. It's like, we're going to get rid of the extra fluid, but we're going to make sure we hold on to the good stuff that your body needs.
Okay, so wow, we've covered a lot of ground today.
We have, from A to Z, or I guess from T to T.
From T to T in this case.
It's amazing to see how these medications target such a diverse range of conditions,
It really is, and it speaks to the power of modern medicine and pharmacology, right?
Yeah.
It's incredible what we're able to do these days.
Totally. And a huge thanks to Dr. Khaled Hassan for making this information so accessible.
Oh yeah, he's a great resource. His podcast is fantastic for anyone who wants to learn more about these medications that we encounter every day. So, highly recommend checking it out.
For sure.
And for you, our listener, we leave you with this.
Ooh, a parting thought.
A parting thought.
I like it.
How many of these T drugs have you encountered in your own life or in the lives of your friends and family?
It's a good question to think about.
It is. It's fascinating to consider how these medications are woven into the fabric of our health and well-being.
Absolutely. They're everywhere, even if we don't always realize it.
Yeah. So keep exploring.
Keep learning.
Keep asking questions.
Stay curious.
And stay curious about the world of modern medicine.
That's what it's all about.
That's what it's all about.
It's a fascinating world.
It is.
For sure.
So until next time.
Stay healthy, everyone.
Stay healthy.